I heard an Alvin Toffler quote recently. The illiterate of the 21st century will be those who don't know how to learn, unlearn, and relearn.
Hello and welcome to Digital Health in Canada, the Digital Health Canada podcast, where we explore the human side of digital health. I'm Katie Brisky.
And I'm Sheila Maloney. Welcome to our inaugural podcast episode. We're so excited to start this journey with you.
A little about the podcast. We talk to leaders on the leading edge of digital health transformation, delving deep into their career journeys, what they've learned, and what drives their work in digital health. We explore the who and the why behind healthcare technology in Canada. And a little about us. I am a podcaster turned digital health professional.
And I'm a digital health professional turned podcaster. Let's get started. Our very first episode. And of course, we're going straight to the topic that is on everybody's mind, artificial intelligence. But what we want to do in this podcast in particular is explore the leadership in the age of AI. And what does that look like? What are the implications for the health system and for users? And what's the potential that the AI might bring to transform the health system? So we're very pleased to welcome our podcast guest, Dr. Mohamed Alarakhia, who is CEO of the eHealth Centre for Excellence in Waterloo, Ontario, and Tim Murphy, Vice President Health at Alberta Innovates.
I'm hoping we can start with introductions, if you can tell us a bit about yourself and your work. Tim, can we start with you?
Sure. Thank you, Katie. Yeah, my name is Tim Murphy. I'm the Vice President of Health with Alberta Innovates. I have a 30-year career. I started my career in oncology at the Princess Margaret Hospital and the BC Cancer Agency for the first decade, and then the last 20 years I've spent in research and innovation. I work currently at Alberta Innovates as the VP of Health. Alberta Innovates is a provincial crown corporation. We are a pan-provincial organization that serves all economic sectors of the province of Alberta. I have responsibility for the health innovation portfolio of Alberta Innovates, and that we have a large focus in digital health as one of our main focused areas of investment. And we're really trying to enable digital health in both life sciences and the healthcare industry to inspire people about digital health. And really, we believe strongly that the future of healthcare is going to have to go upstream. We're going to be digitally enabled and data informed in doing so, and working with our clients and partners in our ecosystem to help transform our healthcare system.
My name is Mohamed Alarakhia. I'm the CEO of the eHealth Centre of Excellence, and I'm a practicing family physician. The eHealth Centre of Excellence is a not-for-profit organization that works from coast to coast, hopefully to coast, in the future, deploying digital health to clinicians. And we support clinicians with using technology to support patient care. So we help with reducing wait times, decreasing administrative burden, improving access to primary care so that patients are not unattached and can see primary care clinicians. We've been doing that for over 10 years, but we are celebrating our 10-year anniversary. So formally, we're an organization for the last 10 years. So our anniversary is this year. And, we've really seen how there's such a tremendous momentum with innovating and implementing digital tools, and clinicians are more ready than they ever have been. And just in terms of my past, I've been doing this for 14 years. I did digital health through medical school and residency. I did a master's of health information science after my residency, just to get more competency in this field. And then I was in the LIN infrastructure and then Ontario Health. And now I'm where I'm at.
Really interesting journeys for both of you. And as you describe where you've come from and how you got to where you're at, I'm curious, what draws you to AI for healthcare? Like, was there a moment where you thought, okay, I need to get involved in this?
Yeah, maybe I'll start off, Katie. Yeah, health data is the currency of all decision-making in healthcare. And I guess since I started my career in 2002 with the research and innovation community, obviously data was the lifeblood of research and innovation, and data is the cornerstone of a learning health system. So I guess when I'm looking at the question around when did I first start to get interested, I guess I've always been interested in health data. But I guess I saw in 2015, I led a project called the Secondary Use Data Platform Project in Alberta, where we had about 17 organizations and 85 stakeholders. And we were really trying to use data, not for primary use in care, that's important, but we were looking at it from the secondary use of the data for research and innovation. And that's a project that got me interested in it. And then in 2018, there was a project, we had 40 stakeholders get together, artificial intelligence in health. And that's when I first started to look at the power and potential of artificial intelligence and how those tools could become really effective in helping enabling a more sustainable healthcare system, a more learning healthcare system. So that's where my interest started my whole career, but then just more recently as the tools became more into focus, how that really brought it into the present.
And Mohamed?
Like Tim, I'm a bit of a data geek. I'm not sure if he would appreciate me calling him that.
I think you're in good company here.
There you go. One of our first projects was standardizing primary care data. And so we actually had students go into EMRs and structure the data in medical records because really it's not that great. And we had down to the minute in terms of how long it would take to structure data in the medical record. And I think it really started from there, just understanding the power of data and what it could do to help, like a clinician like myself, practice better. If I know my patients have heart failure, then I'm more likely to follow up with them and more likely to do proactive management. And we can use our information systems to actually give us advice in terms of what someone needs to do. As a family doctor, I have to know a lot about lots of things. And if our systems can help us, then it makes my job easier. But you really need the data to do that. So just like AI, my interest in different things has sort of been high at certain times when you think about great potential. And then you hit AI winters where it's really like AI is not going to solve the world's problems and it's not going to be as impactful. But I think Canada is such a superpower in AI. So it was always there in terms of the opportunity to leverage it. And, I'm in Waterloo. We sort of talk about the Waterloo-Toronto corridor where we've got tremendous brilliance in terms of being able to get things done and leveraging data. And so it was always sort of there in the background. I would say about 7-8 years ago was more when I started to do more things in this domain. And then really about 4 or 5 years ago when I saw my first demo of an AI scribe and just thought about this is going to be amazing, not just for my practice, but for our health system as we're able to take data, a conversation, and make it into a synthesized note and then leverage the data for follow-up actions.
I love that you're so excited, and then the data geekiness comes through, Mohamed, as you're talking in a very nice way. I mean that very complimentary. But it's kind of interesting that anywhere you go, you're at a dinner party, you're talking to your neighbor, everybody has an opinion on AI, and everybody potentially has a different understanding of what it is or maybe what it isn't. So I'm wondering if you can comment on, everybody's heard of ChatGPT and those kinds of things. How do you see them impacting sort of the potential for AI? And people will say it's the next best thing since sliced bread, or it's going to ruin the world. So can you talk about that a little bit?
It's interesting, ChatGPT had 100 million users in 2 months, right? It beat out TikTok, which took 9 months, and Instagram took 2.5 years. And, my patients use it. I was in clinic earlier this morning and the patient was like, I've been online and been looking up this stuff. I was like, wonderful. That's really great. I love to have informed conversations with patients. And he was talking about different tests that we might do moving forward. Those are the best conversations that we have because the person is invested in their care. They want to talk through things. And frankly, sometimes it does take longer to say, okay, we don't actually need to do this test right now because of these reasons than just maybe ordering the test or not having as informed of a patient. But that's what we need to do. So AI is easily within reach to patients. And so that's a good thing, and to consumers as well. When I talk to patients about using AI in my practice, they understand why I might use it, but there's still concerns, right? There's still issues in terms of what's happening with the data, like bias, what data sets are you using and how does it impact my care? And also is it transparent? If AI is doing something and we're making decisions, is that going to support understanding why we make those decisions? So I think those are the big things that people are talking about. Overall, it's a positive development as long as we discuss it, as long as we're very open about using it. And what I think we should do anyways is co-design with patients and clinicians how we're going to leverage it to make our health system better.
100%. I mean, the positive change with generative AI, ChatGPT, all those innovations has been the democratization of the information, right? That's been a positive change. And I think the negative, I guess, artificial intelligence for a lot of people is still a black box. There's a great expression, trust is a determiner of health. Citizens have to trust your competence in handling their data, and they also have to trust your motivation for accessing your data. So artificial intelligence is dependent upon access to vast quantities of data. And trust is earned, it's not given. So you have to find a way to be transparent, as Mohamed said, and you have to find a way to bring people along with trustworthy behaviors and transparency, which is absolutely key. And I do agree with Mohamed about the pace. I mean, that it's incredible, that democratization, but that's in the hands of citizens. That's not in the hands of university professors and academics who are testing and validating the models. The models are in the wild, and now we've got to find a way to regulate while this happens. So that's probably our biggest challenge going forward.
Tim, you make me think of an interesting thing about digital literacy. It's so much more than just knowing how to use a tool, right? It's also having the motivation, it's having that trust, as you said. Do you think that there's maybe a different way with AI that we need to approach digital literacy amongst the general population?
I'm a big follower of Stephen Covey, right? And he taught us mindsets, skill sets, then tool sets in that order, right? And I think oftentimes in healthcare and other sectors of innovation, we focus on the tool set too quickly. We don't create the skill sets to use the tool set, and that we don't help people with the mindset change around that. And if you don't put the mindsets in place, you don't develop the skills, then the tool set will underperform or be unused. I put a lot of my effort, my team put a lot of our effort at Alberta Innovates in trying to think about how do we create the right mindsets for the new world we're heading into. As you said, that sort of building that trusting relationships and helping people with digital literacy. And then the other thing is we have a focus on sustainability. So we really want to bring everyone along, no one left behind on this journey. And I think there's a lot of people being left behind. And I worry we have to be more inclusive in our approaches. And so, again, mindsets, skill sets, then tool sets in that order. Otherwise, we won't achieve our potential. It may even set us back if we have something untoward happens that puts a pox on all of our houses as we go through this great innovation journey.
I love that because I think we often do start with tools and then kind of work backwards to mindset. But if we're looking more at readiness, societal readiness, health system readiness, what are some of the things that we need to consider for implementing AI?
Yeah, I think first is starting with what Tim said, because I think that's really critical in terms of like understanding where people need to be at as a clinician and patients in terms of leveraging these tools. I also think about it sort of a paradigm that's a bit old, but it's stood the test of times. You're looking at people, process, and technology, and really looking at the technology, again, as one component. And so I'll give you an example. Google has an artificial intelligence tool that helps with diagnosis. They compared this tool with clinicians. So they looked at this tool through a virtual interaction with patients, and the patient interacted with AI, they interacted with the physician powered by AI, and they interacted just with the physician. And the physician did the worst. AI plus a physician did was next, and then AI was superior to all of them. So a clinician using AI was inferior to AI itself. But I think it speaks to the fact that we really haven't supported clinicians with learning about AI and what the value is in terms of that tool. Just like I order a test, then I interpret the test, or I leverage the information from the test to make a decision. How are clinicians leveraging AI? So I think we need to work with clinicians to support them with knowing what a tool does and what it doesn't do. And it is a bit of a trust in terms of trusting the AI and the inputs going into AI, because it is that black box, right? You don't know why it's making the decision. You may never know, but can you use it as one factor in terms of decision making? So I think things like change management support for clinicians are really important as we move forward. Also, the broader role of the staff and the team within this as well. So AI is fundamentally going to change all of our roles. And so do we understand that, and do we work with the different individuals to look at how does AI support patient care in a better way, reduce some administrative burden, for example, and allow us to spend more time with patients and talking to patients and helping them through their journeys. And so I think we need to have the support around that and the knowledge about those different roles. And then I think in terms of just broader society, like as mentioned, like things like consent are going to be really important, and how do patients know that we're using these tools? Do they give informed consent? And then finally, like a regulatory framework. AI is very interesting because it changes, right? There's changes in models, and how do you regulate that?
So you two are both leaders in this space, and it's a rapidly evolving and changing space, as you've highlighted with a number of different examples. So what do you do to bring people along? Because I think it's exciting and it's scary. And you make comments like it's going to transform the way we deliver care. It's going to transform the way we receive care. Those are daunting statements. From a perspective as a leader in this sort of new evolving space, how do you make sure that the system, the patients, the clinicians are ready for this? And you talked about, trust and comfort. Are there any specific things you can talk about that you've done that have been successful in bringing people along?
Well, Sheila, I talked about the mindset, right? So it's pretty clear from all the work we do at Alberta Innovates with our projects that technology alone is not going to solve our healthcare problem. What will solve our problem is partnerships and collaboration. And Mohamed touched upon this with teamwork, right? And I often talk about there's some stats that come out around 14% of research actually makes it to a patient. It takes 17 years from the discovery of knowledge to the impact in policy and practice. AI, artificial intelligence, is going to transform all of that, right? And it really will allow doctors to be doctors and nurses to be nurses and OTs to be OTs and PTs to be PTs. It should enable them, as Mohamed said, to do that activity. I want to touch upon one thing he mentioned. Canada is the land of pilot projects, right? As Monique Bejean once said, we are pilot projected to death. We don't do things at scale, but it's not enough to just add more investments to the projects. Success requires a rapid modernization of our regulatory environment. So everyone has a role to play in this journey we're going down, and that will create what I would call innovation readiness of our health system to adopt and absorb the changes. We have significant problems, though, in our current system, right? So that's going to be our largest headwind. There's all this innovative technology that can add great value, but if it doesn't go into a receptive environment and it doesn't get executed against, then it's just interesting technology, right? So how do we bet? So I think we need to work on both sides of that equation, Sheila. We have to prepare the environment for readiness. Again, mindsets. We have to give people the skill sets. It was once saw a stat just recently at South by Southwest that said since 2015, post-pandemic, 28% of the skills of a healthcare practitioner has changed. Yet only 11% of health practitioners have been offered any training in artificial intelligence, machine learning. And we also know, according to the World Health Organization, that we're going to be 18 million health practitioners short by 2030 globally. So we need to really invest in innovations and invest in labor conserving and labor enhancing technologies, and then have that go into a receptive environment so that the environment can actually give back. And we can create that virtuous so-called learning health system that can actually drive value.
And if I could just add to what Tim said there, which I think is bang on, there are going to be certain things that just stay the same within our healthcare system, right? The clinician-patient relationship, physician-patient relationship is absolutely key. Like we need to have those relationships really foundational for keeping people healthy and well. And we know from the literature that, having continuity of care is absolutely critical to patients' decreased morbidity and actually some studies suggest mortality. And so I think there's some foundational things that we need to keep irregardless of what we're leveraging. Things like the patient at the center, the patient and family at the center, that's always going to stay the same. We're not going to change that. Patients having full transparency in terms of what's happening with their care, that needs to happen. And in fact, will be enhanced. But we need to have those foundational elements always there. And they're touchstones for us whenever we implement things. Are we maintaining those things? I also think we know the system is not working right now, that there are challenges. Like there are lots of errors that happen today, right? And as we implement and do these things, it's not in a situation where things are going really well and then we're disrupting it just to try some cool things out. It's really like we need to take these steps so that people are served better, so that errors don't happen, so that wait times are not that long to see a physician in the emergency department, so people are not waiting too long for their hip surgery. So we need to move forward and try things out so that in a way that we've got those foundational pillars still there so that we actually do move forward and support patients in the way that we need to. And to pull on what Tim has said, the polypilotitis that we do with all these pilot projects really does waste a lot of effort. And what we need to do is we need to try things out and we need to fail. But then the things that work, we need to scale and spread. And we need a model for that. And we've had challenges as a country actually doing that, scaling and spreading things, and patients are not better off for it, right? I think we are letting them down because we're not really serving them as well as we can with the ability that we have.
It's interesting, pulling on what you both have said. I think, yes, Canada is the land of pilot projects, but also of incrementalism. You're
absolutely right. Like we do incrementalism, and I think it's because there's a lot of risk, right? Like we think about the risks of doing something in a healthcare space, and then we do stagnate because of that. And of course, it's important to do things in a very safe way. But to the point earlier, like there are unsafe practices happening today. There are errors happening today. So I think we need to create an environment where it's okay to try things in a safe way because patients will benefit from that with the patients involved, with clinicians involved, but make bigger changes to the point of like we can't live with incrementalism because we're already struggling with long wait times, and we make small changes, they're just going to get worse and worse. We need to make some more drastic, and maybe not the right word, more significant changes so that patients get better service.
So at Alberta Innovates, we partner and collaborate with our innovators, right? We get resources in their hands so that they can succeed or fail fast, exactly what Mohamed said, because we want to make sure we don't, as we go through discover, develop, and use of an innovation and technology, again, that journey can take 17 years. We have to dramatically close the gap on that time frame. But that's, again, that risk, how we deal with risk in healthcare and how we, I think it all comes from the Hippocratic Oath. First, do no harm, right? So that seems to be our mantra in healthcare. But I think right now the technologies, not using the technologies, are creating harm. We talk about data sharing. So there's harm in data sharing if there's a data breach. Absolutely not a good thing to happen. You don't want that to happen ever. That's a bad harm. There's also harm now in not sharing data and exposing data to some of the technologies. So how do we take that into account into our regulatory environment, into our Health Information Acts, into our privacy legislation? Like, we need to think about this a little differently. And I'm not saying privacy it's not important. It's very important. But again, we have to balance that equation. And that was the big key point of the Interoperability Saves Lives working group, the group that I was able to have the privilege of chairing in 2023. We produced that report just to stimulate the conversation. It's gotten people thinking about, well, what can we do then? And where are the guardrails? And how do you do it safely? And how can we do this differently? And that's that mindset shift we have to go through to get to the skill sets, to get to the tool sets.
Yeah, I think there's no question the health industry, we're quite risk adverse, and we're reasons why we don't want to try things and people don't like change. But this is accelerating so quickly, and we don't have the governance structures or the regulatory structures. And I think in the perfect world, everything would stop till we got it all figured out, but that's not going to happen. And the pace of acceleration will continue. So here's what I'd like to know. What's the one initiative that you're most excited about? So Mohamed, you talked about your scribe. What are you working on now that excites you and you want to talk about every chance you get?
Well, there's so many things. So you're forcing me to pick one. But I would say I'll talk about scribes and bots. So it's sort of a combination. I think the ability to take the documentation burden away from clinicians with artificial intelligence scribes is huge, right? I use it in my practice. And it's been great. Like I can get home earlier. I can spend more time doing proactive care on patients because I use a scribe. But what we're doing is we're actually linking the scribes to bots. So these are virtual assistants that can actually do follow-up actions. So even better, I see a patient in clinic, the scribe writes the note, and then if the patient needs a follow-up appointment, we have a virtual assistant that will send them an online appointment booking link. If they need to do lab work for that appointment, they'll have a lab requisition attached. If they need a referral, we'll look at sort of bots doing the referral, and they'll be able to say, this patient needs to see a neurologist. I've talked to the patient about it. They'll make up the neurology note and send the right things to the neurologist. So the neurologist will have all of that information. So it's not dependent on me maybe remembering that patient needs to see a neurologist. So really getting virtual assistants within any clinical environment. We focus on primary care, within primary care, where there is such a challenge in access to clinicians, where millions of patients are unattached and are not able to see a clinician in a timely way. And we know where that makes a difference in terms of ER utilization and overall sort of wellness. And so I think if we can reduce that burden, that the 40% of time that's actually spent on administrative tasks, if we can reduce that, and I think we can, like 20, 30% of that, we can, I think, fairly easily reduce with the tools that we currently have, that will have a profound impact on patient access to primary care.
Yeah, I agree. That non-clinical focus is absolutely where we need to start. I think that would really help. If you can help, again, physicians be physicians and nurses be nurses, and you can take that administrative burden off of them. I mean, in the US, it says that for every hour a physician spends with patients, they spend 2 hours doing paperwork in the evening, like it's with EMRs. Like it's artificial intelligence has to save time rather than take time. I always encourage our innovators to focus on that. Again, that labor-conserving, labor-enhancing technologies where we can, when we can. What gets me excited, Sheila, is all the projects we're doing at Alberta Innovates. We have over 100 projects. They're not all artificial intelligence, machine learning, but the vast majority of them are starting to incorporate artificial intelligence and machine learning into their innovation, which is really going to be key. One of its superpowers of AI, of course, is to make the invisible visible, right? Things that we didn't see in the chart, we can begin to save lives. I love that example in Toronto, Mohamed, with ChartWatch and what they're doing in the ICUs at St. Mike's Hospital. They've had a 26% reduction in mortality by looking at several indicators for patients in the ICU and giving a note to the physician or to the nurse practitioner or to the nurse team to look at that patient and go back and take another look at what's happening with their enzyme levels or what have you. And that's been able to really show demonstrable impact on saving lives. So it will have that benefit. And I think we're seeing more and more of that. But we got to have the regulatory environment, as you said, Sheila, in place. And I know we don't have it today, but we're working on it. There's never been a better time where there's been all this convergence between awareness of the opportunity with the readiness of the system to adopt that's kind of in crisis. So the crisis, I wouldn't say it's good. I would say that it's don't let a crisis go to waste, though. Let's think about how we can do things differently in this moment in healthcare to really add value to health outcomes and add value to economic diversification.
What strikes me about what both of you have said is there's a really interesting sustainability thread. And I think part of what we're seeing now is that the way that we do healthcare is not sustainable. So I'm wondering, as we think about the effects of AI socially, even environmentally, people often forget there's an environmental component to AI and the resources it requires. As leaders, what should we be keeping in mind to ensure that we can implement AI in a sustainable way?
Well, Katie, for our artificial intelligence enabling better health call, which is we're going to have about 12 awardees announced in a few weeks' time. We've adopted the 2030 Agenda for Sustainable Development because we accept the principles of, back to the point that Mohamed made about the bias in data. You want to make sure your data is as comprehensive as possible, that there's huge health inequities in Canada. We want to make sure we don't leave anyone behind in that structure and how we go forward in that. So we believe that scale and spread of communication technologies and that global interconnectedness has the ability to accelerate research and innovation. And that sustainable approach will be very much key. You mentioned the energy consumption. We need to put these in a cross-sectoral lens and think about all these things, not just in the health world, but also across all sectors of innovation and research. There was a stat I heard about a year ago that if healthcare were a country, it would be the 5th largest emitter of greenhouse gas emissions in the world. Most people don't think about healthcare that way, but we got to start thinking differently and seeing things differently and thinking more cross-sectorally because we got to put these value chains together, I think, in different ways. And so that's what I would really encourage. And I hope that working with Mohamed, working with other people across the country that are like-minded, we can begin to create a critical mass of people who think this way and who can help us support the sustainability of our healthcare system for Canadians.
Yeah, and I agree with Tim on that. I heard Elizabeth Keller from Amazon was talking about how 5 queries take up a bottle of water, like a 500cc bottle of water in AI. So I think we do have to be very thoughtful about it. But I also think about the impact it can have. And so this is sort of on the other side. If patients can be better monitored at home, they don't need to travel. And we can leverage AI to support patients with more personalized remote monitoring so we know what their targets are. And the AI will modify their alerts and alarms so people are not overly worried about that and patients can stay at home longer. Now they're talking about the sextuple aim, where we're looking at supporting environmental stewardship and building on what Tim said in terms of social determinants of health and being able to identify whether a patient has struggles with, being impoverished, for example. It's really hard to actually gain that, but we actually have the data to be able to understand that and then to support the patient with the services that the patient needs. And so, we're able to leverage AI to support serving the patient better. Also, in terms of sustainable health systems, if we keep on burning clinicians out, then we won't have a sustainable health system. Whereas if we reduce admin burden and we ensure stability of that workforce so that we can actually serve our patients better.
I love that. It kind of brings the conversation full circle, right? You're talking about the mindset, and we know there's tremendous potential in AI, tremendous potential in healthcare, just because there are so many issues that we're having with equity, with sustainability, with the environmental impact. And so there's tremendous opportunity, but with that comes risk. And we need to make sure we don't leave anybody behind and that we do it right. And so you are now leaders at the forefront of this initiative. So What advice do you have? I'm a leader and I recognize that artificial intelligence is going to be good. What do I do? What's the first step? How do I start?
I heard an Alvin Toffler quote recently. So the illiterate of the 21st century will not be those who don't know how to read and write. The illiterate of the 21st century will be those who don't know how to learn, unlearn, and relearn. Artificial intelligence is reshaping many sectors. Post-COVID, post-ChatGPT, generative AI. It is changing the skills of healthcare workers. So the jobs are changing, whether you're changing jobs or not. So it's moving. So I think the key message I'd leave behind was we have to work on the skill sets, right? So we have to work on transforming healthcare. We have to pull those skills together. And the second lesson I just take away from this conversation is that technology has to be an asset, not a burden. And it's more than just the technology that gets implemented. We have to think about it very holistically. And we have to make sure people have the skills to use the technology. And again, do that in an inclusive and equitable way.
I think those are great things. I might add that we are a superpower as a country in AI, and we need to learn from each other. And we don't do that enough in terms of there's a lot of things that are happening across this country. And how are we able to learn from that and build on each other? How are we able to learn from the success that's happened in one part of the country and take it to another part of the country? Because things are changing fast. So, we can all do our own pilots and learn the same thing, or we can, do things collectively and maybe something like have a registry of all the stuff that's happening so that we know when things have been proven and we can then start to implement those things. And then I think the second thing is, we need to include our patient partners and leaders within this. Patients are getting their information online and they're able to take a look at that. It's been a great thing. And so we always talk about, what would the patient say? Or we're always afraid of, the patients won't want this. But patients want us to move forward. They want us to leverage technology to help their health. And so I think, we need to make sure they're there with us, that we're co-developing the future healthcare system. And I think we'd be surprised as to how fast patients want us to go, having talked to a number of patients with the right guardrails. But I think if we leverage what patients are saying, I think we'll get to where we need to faster.
Tim and Mohamed, we really want to thank you for your time today. One of the things I've loved in this conversation is this thread of interconnectedness. I think you've really shown what we can do when we work together. So really, really appreciate your insights.
Yeah, it's been great. And let me just echo my thanks. I think people who are receiving care and providing care are the ones best able to understand where the opportunities lie. And with AI, we can take those opportunities and accelerate solutions. Really appreciated your input and insights today. Thank you so much.
Very good. Thank you for having us, Katie and Sheila. We appreciate it.
Yeah, thanks very much, Katie and Sheila.
So what'd you think, Katie?
It's interesting because I have had a few conversations about AI, and they're always a little bit different, right? I've had conversations that focus really on the ethics. I've had some very practical conversations about what's the impact natural language processing can have on EMRs. And I liked that this conversation situated AI within the broader context, not just of health, but of many sectors. Like Tim was talking about that cross-sectoral collaboration that's so important for AI. I always like talking about trust and governance, and again, those sort of big pictures that include health, but also include so much more than that, because that's just general sort of information governance. I liked that we were able to take that view of it, and I think there were some really great things for leaders to think about, because it's a very complex landscape. And I think Tim and Mohamed did a great job guiding us through it.
Yeah, I agree. And, to me, and you said it before, and we've all had conversations with friends and neighbors about artificial intelligence. And it seems to me that nobody's neutral about it. Either strongly believe it's going to change the world for the better, or they think it's going to destroy the universe. And there's very few that are, in the middle of that or neutral around it. And so I really like the conversation about, first of all, a reminder that our health system has some flaws, and the sustainability issues and the physician work life, like those things are real. And so let's not pretend that we have the best health system and that we do need help. And if we have a technology that can help us accelerate the change that's required, let's use it. Having said that, let's be mindful, and you have to bring people along or educate people and have people excited about the opportunity. If it's viewed as a threat, as a patient, as a clinician, I am not going to embark on the journey and have a different mindset. So it's really that let's make sure we're doing the right things for the right reasons and everybody understands and we're transparent about it and we build those relationships so that we are all working together towards a common goal. And I really like that comment that Mohamed made at the end too about sharing our successes. This might be an opportunity to do that. We can make some significant change and significant improvement quickly given this technology.
Yeah, and I like that leading with mindset and leading with motivation and intention as opposed to leading with the tool. So I'm curious, what gets you excited about AI?
Again, people and patients understand what the issues are. And if you can say this particular problem we need to solve. So you don't start with the technology, you start with the issue or the problem. And then if you have technology, artificial intelligence, something that will allow you to get to a solution more quickly, or that administrative burden one is a perfect example, right? Like we know how much of an issue that is for clinicians. If we can take that away, that makes a significant impact quickly.
Absolutely. It occurs to me, I think the health system's probably like audio editing. If it's all going really well, you don't really notice it. Because I'm thinking there is a certain level of health system literacy amongst the general public that I'm seeing more and more, right? People are more aware of the parts of the system and how they work together or how they don't. And again, not that the challenges we're seeing in healthcare are a good thing, but I think it has led people to be more aware of the system around them and maybe able to take a more active role and have a more active voice in it.
Yeah, and more aware of the need to make the change and look for different means to do it. That really makes a lot of sense.
And listeners, thank you so much for tuning in. I hope you enjoyed the conversation as much as we did. We will be back with a new episode next month, right here on Digital Health in Canada, the Digital Health Canada podcast. Thank you for listening to today's episode. Digital Health Canada members can continue the conversation online in the Community Hub. Visit digitalhealthcanada.com to learn more. Be sure to subscribe to the podcast to get new episodes as soon as they're available. And tell a friend if you like the show. We'll see you next month. Stay connected, get inspired, and be empowered.